Good evening, everyone. Thank you for joining us once again for a Friday webinar series. Today's webinar is on stress and anxiety, coping during the COVID-19 pandemic. My name is Brett Spitali, and I'm the Vice President of Advancement here at the National Hemophilia Foundation. At any point during the webinar, if you'd like to ask a question, please use the Q&A feature at the bottom of your screen. We have NHF staff members monitoring these questions, which we will pose to the panel at the end of the presentation. This webinar is being recorded and will be available to the community beginning on Monday, the 20th. I would like to introduce our panelists this evening. Dr. Len Valentino is the President and CEO of the National Hemophilia Foundation. Sandra Balbinos Heredia is a licensed clinical social worker at the Children's Hospital of Los Angeles. And John Velasco, who is the Education Manager at the National Hemophilia Foundation. We thank them for taking the time to join us. And I'll now turn it over to Dr. Valentino to get us started. Len?
Thank you, Brett. Good afternoon, good evening to everybody who's on the call with us. I hope you're doing well, staying safe, and are healthy. Tonight is a very special webinar for us, as this is World Hemophilia Day. So we're celebrating hemophilia, even though we have this pandemic to have to deal with. And we know that stress and anxiety are important topics that you probably might be dealing with in your own family at this time. So we wanted to share with you some insights that may be helpful for you. Next slide. So in honor of World Hemophilia Day, this is a series of photographs from some of us at the National Hemophilia Foundation, where we wish to thank you for your support of the National Hemophilia Foundation and the World Federation of Hemophilia for all of your dedication and efforts. So thank you very much. And next slide. I wanted to start with a little overview of the current situation and the recommendations that are being provided by the Centers for Disease Control and Prevention. The first thing is that a cloth face covering is now being recommended since our last webinar. And this is important to protect others if you are infected. This is not a protection for you necessarily. If you're sick, you shouldn't be out. You really should be quarantined within your home. And if your symptoms are significant enough, as we've talked about in previous webinars, you should seek medical attention by first calling your healthcare provider or your HTC before going to an emergency room or to the hospital. And as we talked about last week, telemedicine may be an opportunity for you to interact with your healthcare team without leaving your home. We have to continue social distancing. That's the main mechanism for the prevention of spread of coronavirus. And we want to maintain that social distance with about 6 feet between ourselves and others. I also want to make a special notice that if you have had symptoms of COVID-19 or you've been tested, that please report this to your hemophilia treatment center, as the American Thrombosis and Hemostasis Network is now collecting this information through the hemophilia treatment centers so that we can get an accurate number of individuals within the bleeding disorders community who have had COVID-19 and or coronavirus infections. A notice was sent this week to all hemophilia treatment centers advising them of this change within the data capture module. So let your HTC know if you've been diagnosed or tested. Next slide. I wanted to give you a little idea about what we might be able to anticipate to come based on lessons that we learned from a previous disaster, 9/11. There were significant mental health implications from the 9/11 situation that are in some ways comparable, but in other ways quite different from COVID-19. The 9/11 was a single day experience that was time limited in terms of its event. However, the implications of 9/11 last very long and are in fact lasting to this day. So the tail of this is continuing onward, as you can see from the figure on the bottom. COVID-19 is a somewhat different situation where the first case was diagnosed in China on November 17th, but by the end of December, there were more than 180 cases in Hubei province in China. As of today, there are almost 700,000 cases worldwide including 36,000 deaths. But importantly, about 60,000 people have recovered, which is very important for us to recognize in the United States. So the duration of exposure may be quite different from a single event versus this long exposure with COVID-19. However, both are viewed as sort of a militaristic campaign, a war on 9/11 and also a war against COVID-19. But we have to consider this in the context of our current political and social environment where there is a heightened level of discord. And this can bring additional mental health issues to the forefront. Next slide. So when we think about populations that might be vulnerable for mental health issues, we can learn lessons also from 9/11, where healthcare workers were significantly impacted. That's not the topic of our discussion this evening, but we want to make sure that healthcare workers are getting important interventions along the way as well. In terms of non-medical essential personnel, government employees, healthcare administrators, and other people in the hospital, medical support staff, food service and delivery workers are very important, and were important in 9/11 as potential vulnerable populations. Other people at risk are those that are providing the cleanup, asbestos workers, city employees, and volunteers. Children we'll talk about in a few minutes. And then, of course, the LGBTQ community may have particular vulnerabilities at this time during COVID-19. Next slide. So we can take some information from this study that was performed in Guangdong province in China in the mid to end of February, where an anonymous questionnaire was sent to individuals to assess their level of psychological distress. In this study, 30% of those infected with COVID-19 had symptoms of depression. This was not dissimilar from the general population, where almost 35% were experiencing depression, versus 10% of those that were in quarantine. The authors speculated that although the difference in depressive symptoms was not different between the people infected and the general population, those that were in quarantine may have felt some sense of security because of the quarantine. And importantly, at least in this study, anxiety was not different across the three groups. Next slide. We'll see in a few minutes that that wasn't the case in another study. So what are the types of problems that we might encounter in these populations? Well, post-traumatic stress syndrome is one, clinical depression, recurrent alcohol use problems, and the risk of family violence. This is spousal violence as well as child abuse. And we know that there are potentially some differences in post-traumatic stress syndrome. This has already been demonstrated in China, where the prevalence of post-traumatic stress syndrome was 7% 1 month after the outbreak. Women reported more problems with re-experiencing, negative alterations in cognition and mood, and hyperarousal syndrome. So we have to include women in our vulnerable population as well. Next slide. This study looks at generalized anxiety disorder, depressive symptoms, and sleep quality during the COVID-19 outbreak, again using a web-based survey. An anonymous survey was completed between February 3rd and 17th. There were over 7,000 respondents, about half male and female. But importantly, in this population, 31% of the participants were healthcare workers. The prevalence of general anxiety disorder was 35%, depressive symptoms 20%, and sleep quality was altered in 18% of the population. Progressive depressive symptoms were more common in those less than 35 years of age, and poor sleep quality was reported more frequently in healthcare workers. So again, we're looking at what these vulnerable populations may be, and younger individuals may be at greater risk for these depression, anxiety, and sleep disturbances. Next slide. So I wanted to just show one slide with a special emphasis on children. This was another study from China that looked at emotional and behavioral disorders in children during the COVID-19 outbreak. And you can see here that many different types of symptoms were reported in these children. So we have to pay special attention to them. We might think that the clinging behavior is a nuisance when we're trying to work from home. But again, this is a symptom that the children may be manifesting that we really need to pay attention to and help them cope during this stressful time as well. Next slide. So I'd now like to turn over to Sandra Valdivinos from the Children's Hospital of Los Angeles and John Velasco from the National Hemophilia Foundation to talk about what is stress, symptoms of stress, stress reduction, and then some mindful exercises that you might be able to use at home to deal with any anxiety and stress that you're having. Sandra and John?
Great, thank you. Thank you, Len, for that introduction, and thank you everybody for joining us. And it is a privilege to be here with you all. And thank you, Len, for also laying the foundation for this discussion. And today what we're going to be looking at are those elements of stress. You know, we're going to create a working dialogue and a discussion and understanding of the principles of stress. Then we're going to go into further looking at the symptoms of stress and looking at the different categories and how that stress manifests itself within our bodies, within our minds, and our spirits. Then we're going to look at a couple of stress reduction opportunities for us to do. And we're going to ask you, if you have a minute, just go grab a pen or pencil, or you can also type some of your answers in here. Throughout the next half hour that we have together, we're going to ask you a couple of questions about your body, about your mind, about your emotions. We would just want you to be mindful of those. So if you want to write them down or not, no worries, you can just have them right on the top of your mind. And then we're going to end today's presentation by giving you 2 mindful exercises. And both of these exercises are ones that you can do at any point in your day, whether you're alone, whether you're in the bathroom, or you're working from home, or you're helping your kids study. So one thing that we also want to understand is that we're all in this together. Next slide. So a working definition that we have, and you know, it's been a privilege to work on this with Sandra, and she's going to be speaking very shortly. But one of the definitions that we like to work with is stress is the normal reaction the body has when changes occur. It can respond to these changes physically, mentally, or emotionally, and I'd also add spiritually. You know, I like to work a lot on analogies, and an analogy that I like for us to be mindful of is that stress is part of life. Stress is part of the universal way of being. For example, the sun. We all need the sun. And some of us, when we see the sun, we get really happy. You know, I'm one of those people that need to be outside, need to be in the garden, but also I'm very mindful of the dangers of the sun. Yes, we need the sun for vitamin D production, and that vitamin D is so important in our lives, but also too much sun, well, some of us can burn. And there are some other issues with too much sun. For example, take leaves on a tree, for example. Right now, as most of us are experiencing spring, those trees and those buds are about to bloom, right? And they need that energy of the sun. However, when the sun is too strong later on in the spring and later on in the summer, the leaves actually just slowly find that energy of stress, and to protect themselves of the stress, they kind of become limp. And then when the sun is not as hard, they come back. So what we want you to understand is that nature deals with stress on a constant basis. So what we want to focus on is what are these elements of stress, and then what can you do more importantly to find that balance and discover, either working on the skills that you have or discovering new skills. When we're looking at kids, and you know, Len talked a little bit about that, when we're looking at kids, they are still developing. Young folks are still developing what are those defense mechanisms that they can figure out that they have, that they've been taught, or that they're learning about when it comes to stress. Next slide. So the 3 types of stresses that we're going to be looking at is the positive stress, right? which is brief increase in the heart rate, mild elevations in stress hormone levels. And when Sandra and I were talking about this, yesterday we were like, I'm feeling a little stressed about this, right? Sometimes stress is important and stress is needed, right? That's a positive stress. When you're about to go do something, when you're about to propose, when you're about to ask somebody on a date, when you're about to do something a little bit different, maybe ask for a raise, right? You get that energy in your body. That's a positive type of stress, right? The next one is tolerable. And what we actually see here is a little bit of serious or temporary stress responses that is buffered by supportive relationships. So this is usually when you're feeling some of that stress, you're calling a friend or you're texting a friend or you're doing some of your meditations, where you're looking for that support to help you get through that process. The last type of stress that we want to look at is the toxic one. So this is the one that I was talking about, when that sun is beaming really hard on you or on nature and it feels that stress. This is prolonged acceptance of protective relationships. So usually when we don't have that support system and where we're not able to find that type of shelter. So that's the type of toxic stress that we're going to be looking at also as well. Next slide.
Thank you, John. So now I just want to talk a little bit about what is stress. As we see here in the image, there is the flight, fight, or freeze response. This is our body's natural response to danger. So what happens is when we perceive that there is a threat, our bodies naturally do wonderful things to protect ourselves. An example is if we're confronted with a tiger, then our body, there's physiological reactions that are automatic that occur that protect us so we can run away from the tiger. The freezing response involves stillness. Before you make any move, this is a way for us to stop and think about our next move. This is another way that we defend ourselves against our perceived danger or real danger. Another example could be when you're driving. I know many of us aren't right now, but if you're driving to the grocery store, for example, in California, and there's a car in front of you, you press on the brakes. That's an automatic response, right? So although this response is automatic and it is natural, it's important to note that it can be heightened. What we want to be mindful also throughout this webinar is these are general responses to stress that we're going to be discussing. For purposes of this webinar, we're not going to be delving deeper into other pre-existing mental health symptoms or issues that may heighten the stress response. Next slide. So the 4 categories that we're going to be discussing today is the physical, mental, emotional, and behavioral responses to stress. This is not an exhaustive list, and what you may experience are stress symptoms that overlap. Some may last longer, some shorter than others, and everyone experiences these in their own manner. With COVID-19, what we know is that we all experience stress. We're all experiencing this together. As John mentioned, we're in this together. And also, it's important to note that for some of us, it may be a little bit more heightened in terms of what we are experiencing. Next slide. One of the first categories is the physical category. This is, again, not an exhaustive list. But we did want to highlight some of the symptoms that we may experience, as in headaches, diarrhea, for example, excessive sweating, back pain. And what you'll notice here that's in bold is muscle and joint pain. We wanted to relate this specifically to our bleeding disorders community because pain is common, whether it's muscle, joint, or any other form of pain in individuals with a bleeding disorder. It is something that we may feel already as it relates to our bleeding disorder, but it may also feel like it's heightened. So it's important to address any type of muscle and joint pain, whether acute or chronic, when there is an underlying bleeding disorder. But we also want to make sure that you are aware that muscle and joint pain can be a symptom of physical response to stress. An example of this, and it's a very simplified example, is if I am experiencing stress due to COVID-19, then my body perceives danger. My body responds in the form of muscle tensing up, and then I experience muscle pain and tension. Next slide. So what we would like for you to do right now is to take a moment to think about where you hold your physical symptoms when you are under stress, and write these down on a piece of paper or take a mental note of your experience. Next slide. The next category are the mental symptoms related to stress. And again, this is not an exhaustive list. Our symptoms may or may not be included in this list, but these are some of the more prevalent symptoms that we may experience when we are feeling stressed. Trouble concentrating, forgetfulness, chronic worry, and catastrophizing. Catastrophizing, just very briefly, I would like to explain what this is, because many of us have experienced it either right now due to the coronavirus or before that. Catastrophizing is when you are thinking of the worst possible situation that could occur, whether it's an event, a situation that you foresee. And with all of the information that we are receiving, and for many people as well, experiencing coronavirus firsthand, physically, for example, your mind tends to go there. What we want to be mindful of, though, is when it gets in the way of your functioning every day. We'll talk a little bit more about how you can get help with this if you are experiencing long-term catastrophizing, where you're trying everything and nothing seems to work. Next slide. If you can take a moment and reflect on the types of mental symptoms that you've experienced. Next slide. The next category is emotional. And these are some of the symptoms that you may have or are currently experiencing. What's highlighted here is grief and loss. And I want to take a moment just to touch on this. The feeling of loss and grief during COVID-19 is a real one. We're all experiencing either one level of it or other. Grief is really a natural response to loss. It's a process, and it's unique to each individual. I want to give you some examples of what that may look like. So there's different types of losses. There's the physical loss. Unfortunately, during this time, many of us have experienced either, having someone or knowing someone who, has died due to coronavirus complications or, COVID-19. Social loss is, the loss of socializing with others in person. That's a different type of loss. Then there's the occupational loss. There are companies that have had to shift the way that they do business, and individuals who have had to, maybe they're out of work. Some of us were working from home. So even if it's a temporary loss, it's still your loss. It's still what you are experiencing. These are emotional reactions related to grief and loss. I like to also share an example of mine. My kids are currently doing homeschooling, and we talk every day about their experience in homeschooling and am I a great teacher or not? That's also included there. But also I give them that space to share, some of their feelings related to loss, and something that comes up for them is missing out on activities at school in person. I also know of individuals who are not able to take part in graduation or culmination ceremonies. Because these are uncertain times due to COVID-19, we can also experience a lack of hope, lack of hope and optimism. And as a result, we may feel overwhelmed. Next slide. So again, if you can take a moment and please jot down or think about this question. What emotions have you experienced? And also, it's really important so to think about our culture and our belief systems as they relate to our emotional experience. What's really important here is to know, is to be aware when these emotions do surface. It's equally important to know that some of us may not be aware, or some of us are in the process of learning to be aware when we are experiencing these emotions. Sometimes being aware of some unwanted emotions, as an anxiety, for example, it can impact us. The key here is that once you are aware, you're able to identify these feelings, and hopefully even further, you're able to connect that feeling to why you're experiencing these emotions. One of the examples that some of us may already be living is we're living in multi-generational households under the same roof, and we're experiencing this 24/7. And so what does that look like for you? What are some of the feelings that come up? If you are a parent, for example, caring for children, how are they, Dr. Valentino talked a little bit about this, how are they exhibiting some of these behaviors? Some children, they're nonverbal. So you may see some, behavioral tendencies or emotions that come out in behaviors. So this is important to note as well. Next slide. The next category is the behavioral category related to symptoms that we experience when we're under stress. And again, this is not an exhaustive list. I find myself going to the refrigerator often, snacking more often. So, it's a response that I'm having, overeating. Some of us may experience loss of appetite, difficulty sleeping. Maybe our minds, are occupied. Loss of motivation, irritability. There may also be an increase in alcohol consumption, and as well as interpersonal conflict. So some of these are, what's important to note is that many of these are coping mechanisms, right? We are using this during COVID-19, many of these in lieu of maybe some healthy coping mechanisms that we were using before the COVID-19 outbreak occurred. An example is if you are someone who likes to work out, maybe you were going to the gym often, right? Now that's not an option. Maybe you were, going to the Zumba class with your favorite instructor. Well, now you've had to shift some of your coping mechanisms, and maybe now that you're in the house, you're doing that, but you're doing that online. Remember that these behaviors are also on the spectrum. Next slide. Please take a moment and think about what behaviors you've experienced related to when you are feeling stressed, and jot these down. Next slide.
So one of the things that we also want to be mindful of is stress relief. When you experience stress, what are some of the things that you do to help lessen your stress? Many of us have our own coping mechanisms, as Sandra was talking about, whether that's yoga, whether that's gym, whether that's gardening. And sometimes now where we are living in this time in history, which will end, I want to keep emphasizing that this will end, is some of those stress relief opportunities no longer exist for us. So it's how do we find that other component to create that stress release that was so normal for us? My dad, for example, is 73 years old. He's actually on this webinar. His birthday was just 2 days ago. And, for him, going to the gym was really important. When it got to that point where his gym closed, he didn't have that other component to help him find that stress relief. So it was about him and my stepmom helping him brainstorm, come up with different things. And some of it was physical, and now he's doing puzzles and he's doing drawings and art. So all of us, that sometimes thinking of a new stress relief can be a stressor. So it's finding that thing and experimenting with that, experimenting what that is. What is that that's going to help us find those moments of clarity, those moments to catch our breath, so those moments to release some of that energy. Next slide, please. So some of the things that we have with self-care is we want you to just be mindful of our sleeping patterns. Sleeping way too much or not sleeping enough. And what are those things that we can do to help us improve with sleep? And finding those moments to sleep and maybe explore those moments of napping. I know not a lot of people are napping, and I'm still trying to create the art of napping. Exercise. Not having that ability to be outside depending on where we live. So for example, I currently am in Kansas City, not in my home. I can't go out into my garden and just run around my house or pick up some dirt. So, what I do now is just go up and down 6 flights of steps, put on some good music and just move my body to get that energy moving around. Healthy eating. This is a tough one, especially for those of us who are not able to go to the supermarket or waiting, a couple of days or even a week just to get that delivery. So how can we find those opportunities to eat a little bit healthier with the food that we actually have in our homes? So healthy eating is something that could also be a little bit challenging as well. And then taking care of the spirituality. For those of us who believe in the spirituality, just taking time to connect with the universe or connect with a higher power. And also want you to be mindful of that this is just like a working list. We all have different things that we can bring into our lives that's a little bit more personalized, whether that's finding Zoom parties. I actually had a Zoom birthday party a couple days ago, and then somebody in the party said, oh, I have to get off because I have a Zoom wedding that she was going to. So never even heard of that before. So finding those exploratory opportunities for us to connect, right? Connect with our friends, connect with loved ones, and spending time in nature as much, or bring nature into your home, whatever that means. So being mindful of, find those unique opportunities for you to find that self-care that's going to help you through this stage in our lives. Next slide.
Another self-care tip or technique that you can use is or practice is balancing the amount of the consumption of media and the response to it. Due to COVID-19 pandemic, it's important to stay informed with credible, up-to-date information that helps us inform our planning. Yet too much exposure can also heighten our level of anxiety or preoccupation. So it is a balancing act. It is something like John mentioned, it's a work in progress, but it's something that can be done that you have control of. Next slide. Another self-care tip or technique is boundaries with yourself and others on information gathering. So personal boundaries are important in general. They help inform others how you want to be treated and respected. An example of this is my partner and I. We have agreed to dedicate a certain amount of time each day to share information related to coronavirus if we want. But we've also agreed to limit that. So we share that mutual respect and understanding about this. That also takes care of our own self-care and the self-care of others. What you see here is an image of the toilet paper or no toilet paper at a store during the first week of the coronavirus pandemic being broadcasted worldwide. And there was an initial surge of panic shopping for many based on information that we were seeing, hearing, again, this perceived threat, right? So we went into the mode of acting. So I think this image definitely resonates with all of us. And it's important to know that you always have the option to limit the amount of information that you're receiving in order for you to take care of yourself. Next slide. Another technique that we wanted to share with you is the stop technique. Being aware of our thoughts is key to managing our stress. We need to pay attention to our thoughts because they may not necessarily be self-serving. So the stop technique can be used to stop negative thinking and replace it with positive thinking. So if you look at the stop technique on your screen, you'll see the letter S. That means you stop. You stop what you're doing, or if you can't stop what you're doing because maybe you're with the kids, you're saying stop in your head. your T is for taking a deep breath. And you're observing with your eyes, your environment, but also in your mind. You're taking note about your next step before P, you proceed. An example could be, I was talking about this with John, let's say for instance, you are waiting in line at the grocery store at 6:45 in the morning at New York, and you're number 75. So that technique of the stop technique is something that you can use while you're waiting. Many of us have experienced this firsthand, right? You're waiting in your mind, it's very easy for it to wander. Well, you can use this stop technique, and you can also teach it to younger children. Obviously, the communication has to be more age appropriate, but it's a useful tool that you can use on an everyday.
And with the observing part of it, one of the things that I like about this, and that I try to use, and Sandra and I talked a little bit about this too, is try to observe 3 to 5 things that are around you, to help you ground, to help get your mind off of whatever it is that is stressing you. So, or finding 3 things to be grateful for, right? So finding those little techniques within what we're offering to personalize it for yourselves. Next slide. All right, so what we're going to do now is we're going to have an opportunity just to do a physical check-in. What Sandra and I have been talking about today, and with the research that Len was also providing us, is all of this stress has its manifestation within our bodies. And whether that's pain, whether that's discomfort, whether that's headaches, whether that's emotion, we're also having to deal with living in a stressful environment besides even COVID. So COVID is just acting as an extra layer to all of our daily life stressors. So one of the things that we want you to do is just to practice this little technique that we're all going to do together. So we're going to ask you to just, find a nice comfortable space. If you're not in right now, just find what part of your body is a little bit tense and just relax that. And if you can also bring your feet onto the earth, whether in your shoes or if you're not wearing shoes, your sandals. And if you feel comfortable, slowly close your eyes. Bring your eyes to a nice soft gaze. And just take a nice deep breath in, inhale, and exhale. Another deep inhale through the nose. We're going to exhale through the nose. And one last time, deep inhale through the nose. And exhale through the mouth and let it all out. Bringing your focus towards the top of your heads. Just feel that space of the top of your heads with the earth, with the energy above. Bringing your focus now towards your forehead as you relax the forehead. Bring your focus now towards your eyebrows as you allow the eyebrows to melt into your beautiful face. Very gently, very compassionately take the ends of your mouth, bring them up a little bit, creating a nice little smile. Bring your focus now towards your jaw as you allow the lower jaw to drop slightly, feeling that space between your lips, moving the lower jaw from side to side. Relax the jaw. Bring your focus now towards your shoulders. Allow the shoulders to feel heavy as they melt into your beautiful body. Bring your focus now towards your fingertips, whether they're on your laps or they're facing up. But just making that connection to where your fingertips are at this moment. reminding yourself that this too will not only pass, but it will make you stronger and more compassionate. Deep inhale, filling the belly, and deep exhale. One more deep inhale and exhale. Very gently, very compassionately, slowly open your eyes. So that was just a little technique that brings us from the tops of our heads all the way down. Took just a few minutes, giving us an opportunity to refocus. Sometimes I do this in my office and I go to the bathroom. Sometimes I do it just even here, where I'm quarantining myself, stepping away from my computer, stepping away from a Zoom call, just reconnecting myself. Because what we do know is that manifestation of that stress has an effect in our bodies. Now, what we do with that energy, that's up to us. Next slide.
Thank you, John. I feel a lot more relaxed. We wanted to also review with you these very important resources that are available to you. They're going to be posted as well online. So these resources will be available to you. The first couple are a couple of articles from CNN and the CDC, as well as New York Times. Next slide. There are also a couple of mental health hotlines that are important, and regardless of where you live in the United States, you can access any of these resources for free. Many of these organizations have the ability for you to use text as an option. I know it's pretty popular with adolescents, well, many of us now, but with adolescents in particular, if you're someone who prefers to text. Next slide. And this is, again, a continuation of mental health information. Many of these are government agencies as well. We have the National Institute of Mental Health. And also what we want to note is that you want to make time each day to let your body calm. But also if you are experiencing, I mentioned this in the beginning a little bit, if you are experiencing a heightened level of stress that you are finding, you need a little bit more assistance with coping, you can definitely contact any of these organizations, and they can help you link or find resources for you in your area. It's important to another tip that I want to add are wellness checks. So we talked a little bit about the importance of connection, but also you can touch base with other people via Skype, text, phone, email, and just do really quick wellness check. We do that in my circle of friends and family. We do that with each other, and that serves a double purpose. Next slide. And again, these are more mental health care resources that are available. We will post these online. Next slide. Again, these are wonderful organizations like Project of Shine and the American Foundation also for Suicide Prevention. And feel free, please, to share any and all of this information with people that you may know or that you think this would be beneficial to share with. Next slide.
Yeah, and keep exploring. The New York Times is doing some really great articles regarding mental health, which I check in and also share with my friends. And I think I've also shared some with Sandra. There was a great article yesterday that was talking about the stress in terms of living with somebody now that we might be with them for 24/7, whether that's a partner, a friend, or family. So, explore these, and, we encourage you all to share them within our communities.
And lastly, we want to share NHF Guias Culturales. I'm one of the Guias Culturales. We're volunteers. Really, we act as guides to the bleeding disorders community. We also specialize in Spanish-speaking community. We can help facilitate workshops And at chapter events, for example, we also provide information and resource specific to the bleeding disorders community. And we serve as consultants and a resource to NHF and also chapters across the US. If you are interested or you want more information, please feel free to contact John. And again, this information will be posted online.
Yep. And if you're lucky enough, Sandra might be one of your guias when she's doing presentations around the country. And I also wanted to take this moment, since we're talking about the Latino community, that here at NHF, we are so excited to announce that we are going to be doing monthly webinars for the Spanish-speaking community. It's actually starting this Tuesday at 6 p.m. Eastern Daylight Time. So it's going to be a town hall Q&A. Len will be there, and then we also have Dr. Escobar, who works at an HTC in Houston. So if you know folks that might be interested in an all Spanish-speaking town hall, once again, it's this Tuesday coming up at 6 p.m. Eastern Daylight Time. And we're looking forward to seeing some of you and hearing your voices and giving that voice of the Latino an opportunity here at NHF. Once again, it's going to be a monthly webinar. Next slide. And then here we have just a couple of our references, and that we'll leave them up for you all. And wanted to take this opportunity to thank you so very much for having this opportunity to share with you and to just begin this discussion. Sandra and I really talked about that this could be an ongoing seminar, ongoing webinar as we keep exploring stress, but this is an opportunity for us to begin to have that dialogue.
Thank you, John, Sandra, and Len. We have a question that did come in, and I'll pose this to all the panelists. We're all going through so much right now. So how can I tell if it is time to seek other help or professional therapy?
That's a great question. I think that if you're already thinking about it, it never hurts to consult. So you don't have to necessarily make a decision of whether you want to take part in mental health. And thank you again for the question. All you need to do is you can look at one of the resources that we listed. Those are going to be posted online, and you can call and just consult. You don't need to give any of your personal information. It can be very general. You can even say, hey, I'm calling. I would like to gather information for a friend. Just want to know a little bit more about your options in terms of services. Also, if you do have insurance, some like private insurance, for example, you can just call the number that's in the back of your insurance card, and typically a representative will be able to help you determine which mental health providers are covered under your insurance, and if there's like a copay amount or anything that you have to pay. And let's say, for instance, you do decide after you're doing your research, right? This is just a scenario. You do decide, once you do meet with a therapist, it doesn't mean that you need to stay with that person, because when you are in therapy, it's like any other new relationship. You want to feel safe and you want to feel like you're being heard. And so those are just a couple of tips that I hope are helpful for you. Thank you.
Yeah, those are great tips, Sandra. And I really appreciate that question as well, because if you're thinking about it, just doing a check-in is so important. One of the things that I'm constantly learning for myself is making sure that I put on that oxygen mask first and take care of myself. Because the healthier I am, the more I'm going to be able to help my family and my friends and those loved ones in my life. So I'm really glad that you're thinking about that. And again, the resources that we provide here and doing that check-in is so important. Len?
Another important resource is your Hemophilia Treatment Center. So I would suggest that you can also contact them. And many therapists are now doing telehealth visits, and these are now covered by insurance. Yep. So you can have a counseling session using Zoom or one of the other technologies with a therapist from the comfort of your own home as well. So there's multiple different opportunities, but as Sandra said, look towards the references that we're providing on the website for additional ones besides your hemophilia treatment center.
Thank you. I also wanted to note really quickly, I'm sorry that while therapy can help people work through some issues, it's also important to note if you are experiencing any type of maybe symptoms like that relate to suicidality or thoughts about hurting yourself or others, or feelings that are so overwhelming that it's a little bit more immediate. There's also the suicide hotline that you can access and contact. Like I mentioned, there's the text functionality. You can text if it's, you're feeling that this may be the best option for you if you are feeling like you are in a crisis or someone else's that you may know of is in a crisis.
Thank you so much. We appreciate that. We don't have any other questions that have come in. I'll give the panelists one last opportunity to maybe address everyone if you guys want to take 30 seconds each, and we'll move on. John?
Sure. So again, thank you very much for this. And that last question, we can always have so many more conversations about here. But the opportunity here to begin a dialogue, have those connections with folks. And, I love that, what Sandra does is give her, she and her partner that opportunity to have those discussions, what's going on in the media, but also to connect. And, we are social human beings, and even those of us who are introverts are also social human beings. So finding that connection to connect with others, and some of the information that we've had here, please feel free to share with other folks, whether those are techniques that we taught you or some of the resources. The JET Foundation is a great one. There's so many great national organizations out there. And then also knowing that a lot of cities and a lot of states, there are a lot of therapists that are volunteering their time for free counseling and just a free check-in. So we're all in this together. And again, as I started this presentation, this is going to end. And we are going to come out of this such a much stronger community. I truly believe this. So taking a deep breath in and pushing through the darkness, because the light is always there at the end.
Thank you, John. Sandra?
Thank you. I echo your message, John, to the audience, everyone who's tuning in. And I'm just going to end with also a mantra. Mantras are really good and powerful, whatever that mantra is for you. For me, actually, today was "this too will pass." So that's what works for me. So thank you, everybody, for tuning in, and I hope this was beneficial.
Thank you, Sandra.
Yes,
Dr.
I'd like to thank everybody again for attending, and for our panelists, John and Sandra. Everybody needs to continue to stay safe, practice social distancing, and the importance of good hygiene as well, and avoiding crowds. And then, of course, wearing your cloth face mask now in public places. So we wish you well. Enjoy your weekend. And hopefully we'll see you again next Friday.
Thank you.
Thank you, Lon. I'd like to thank all of our panelists for taking the time to join us this evening. We appreciate your time and your expertise. I'd also like to thank each and every one of you for joining us. Please note that there's a new section available under the newsroom tab at the hemophilia.org that outlines all the information and news that we have gathered and shared over the past several weeks regarding COVID-19. You will also be able to find this information in next weekly issue of our Health and Wellness e-newsletter from the desk of Dr. Valentino that will hit your inbox on Thursday morning. If you haven't signed up for the newsletter, you can do so at hemophilia.org and hit the subscribe tab at the top right-hand corner. Thank you for joining us again this evening, and remember, we're always here for you. Thank you.